Hello and welcome to the Hagen News Central. Today's exclusive will be on the gas radon and how it can cause lung cancer. For the viewers who need to be caught up, cancer is a genetic disease where abnormal cells grow uncontrollably and do not know when to stop dividing. Mitosis is the process in which the nucleus of the cell divides and new cells with genetic material that is identical to the original cell was made. It adds cells onto a tissue or organ. When a cell is touching other cells, it normally stops dividing. But when one is diagnosed with cancer, the cells lose the ability to control their growth and division. A clump of cells inside the body, known as a tumor, is formed from cancer, causing the cells to uncontrollably divide. Some forms of cancer can be treatable, and some can cause death. The cancer we'll be talking about today is lung cancer. Lung cancer is a cancer that starts in the lungs, but more specifically, starts in the cells that line the bronchi, which is an air passage of the lungs that branch off from the windpipe. Lung cancer can cause death. Now back to how radon causes lung cancer. Radon is a natural, colorless, and odorless radioactive gas that can be found in homes and can cause lung cancer. Its atomic number is 86, and radon forms naturally from the decay of radioactive elements like uranium. Radon increases the risk of cancer because when inhaled and being in high exposure to radon, it breaks down radon progeny in the air. Radon progeny are tiny radioactive particles that can lodge in the lining of the lungs, where they break down into more radioactive elements by releasing radiation. This radiation can damage lung cells, which leads to lung cancer. The radiation causes damage to the lung cells because the body is supposed to regulate cell division, and the radiation chemicals from radon affects its ability to maintain a balance, causing cells to divide uncontrollably, causing tumors. Many cases of lung cancer have resulted in death. If you are lucky enough not to die, you will be in need of treatment, which causes damage to the organs and side effects of blood clots, bone pain, weak bones, high calcium levels in the blood, memory and concentration problems, tooth decay, dry mouth, mouth sores, diarrhea, fatigue, hair loss, nausea, skin rash, and weight gain or loss, and overall body aches and pains, and lymphedema of painful swelling. The mutations from lung disease involve a precancerous cell that have some mutations but still work like normal lung cells. When a cell with a genetic mutation divides, it passes along its mutated genes to the two new cells, which then divide into 4 cells with faults in their DNA, and it just keeps getting worse. With each new mutation, the lung tissue cell becomes more altered and will not do its job. Then some cells may travel away from the original tumor and start growing into other parts of the body. Not exposing yourself to radon can lower your risk of getting lung cancer because radon is the second most common cause of lung cancer and causes 20 to 21,000 deaths per year. So any chance you get to test your home, workplace, or avoid radon, you should take it because it reduces your risk of getting lung cancer. I hope by seeing these images and hearing the facts about how serious radon and lung cancer are, you will take the steps needed to prevent anything like this from happening in your home, workplace, and any other places. Thank you, and I hope you enjoyed watching this segment on the Hagen News Central.